startling statistic, more than 140 babies died in our state last year from unsafe sleep, the most ever diagnosed. Babies dying while sleeping with their parents or a stuffed animal or blanket. Now the state's on a campaign to change that. 24-Hour News 8's Ken Kolker talked with one grieving mom who wants to add her voice.
I got the message that you don't lay them on their stomach and you don't put a stuffed animal in. You don't sleep with them.
It was a safe sleep message that she watched in a video at the hospital before going home to Hastings with Braden, her baby girl. Another how-to in an overwhelming barrage of how-tos for a first-time teenage mom.
My eyes kind of glazed over.
But she doesn't remember anything about a couch. Last July, it was too hot to sleep upstairs at her parents' home. Mom slept on one couch. Braden slept on a couch just a few feet away.
She was laid down on the couch during the night and I was sleeping, and she slipped underneath the couch arm. And
Braden had somehow wiggled under a cushion. They called 911, did CPR, got her heart going.
I just remember holding her and I was just in shock.
Then, after a day on life support, 7-month-old Braden, the happy little redhead, was gone. We're not using her mom's name or her image because of how people reacted.
People said very nasty things that, like, I killed my daughter and stuff.
Her baby was among more than 140 babies who died last year in Michigan because of unsafe sleep. About 8 a year in Kent County alone. It's a number the state is pushing to eliminate.
We feel that if you continue to ring that bell and ring it loud and ring it long, that, our community will begin to embrace the message.
Today, experts gave a crash course in safe sleep to Kent County's 100 or so Child Protective Service caseworkers who work on the front lines.
Providing a safe sleep environment for our babies would make a great difference in the infant mortality rate.
There have been visits to baby stores checking to see if they promote unsafe sleep. There's talk of new public service announcements like those in other states.
She's not breathing.
What?
She's not breathing. Call 911. She's not breathing.
What do you mean she's not breathing?
She's not breathing.
The main message, babies should sleep alone, on their backs, in a crib. No blankets, no pillows, no stuffed animals. Just the baby.
These are all preventable deaths.
Braden's mom has a tattoo to memorialize her baby.
Our arms for a moment, our hearts forever. It can just happen to anyone. Like, it might not happen the first time you do it. It might not happen the second time, but it can happen. And you should just never lay your child anywhere but in a crib or somewhere safe.
Ken Kolker, 24-Hour News 8.
There are things you can do to keep your baby safe. Your baby should sleep on his or her back, not stomach. They should only sleep in a crib, portable crib, or a bassinet. You should use a firm mattress with a tight-fitting sheet. There should be no other bedding, no pillows or stuffed animals, and experts say that you should dress your baby in a sleeper. Don't use a blanket.
Hello, and welcome to the Cribs for Kids Safe Sleep Champions quarterly webinar, Summer 2025 edition. My name is Devin George, and I'm the program officer here at Cribs for Kids. Today's webinars has us talking with two Safe Sleep champions, checking in with the team at Baby Safety Alliance, and then talking with Rachel Berger as we debut Cribs for Kids professional training series. Before we get started, let me do a bit of housekeeping. If you're joining us live, your mic is muted and your camera is off, so go ahead and enjoy yourself like that. Both chat and both chat and Q&A are available. Chat is for tech kind of comments or requests like, I can't hear you, or can you post that link? Or maybe even a shout out to a colleague you see logged in. Q&A is for questions for us and for our guests. If you've joined us before, you know we don't answer questions during the live portion. There's just never enough time. Instead, we ask you to type questions for us or our guests in that Q&A. And then we take all those questions and send them to our guests for their answers and comments. And then we send those out to every one of you who's registered for the webinar. And there are hundreds of you signed up for today's session, the most ever for any of our webinars, over 500. Thank you so much. Okay, so these questions and answers are sent about a week after the webinar, along with the link to the recording of today's session. because if you've joined us before, you also know that our webinars are live, and you heard me just say GPA instead of Q&A. So they are live, but are recorded. All of our webinars from our 2023 monthly sessions and our new quarterly sessions are on our website under our education menu, and they're also on our YouTube channel. So you can share them, you can catch up or watch on demand if you missed anything. Okay, so that's it. Housekeeping, check. If you logged in at the top of the hour, you saw a heartbreaking video featuring a news report that sets the stage for our conversation this hour. Today's webinar, Your Visit Could Save a Life, brings us Safe Sleep champion, Dr. Rachel Berger. Dr. Berger joins us to discuss the development of our new child welfare professional training, the first module of Cribs for Kids' new professional training series. It's designed for this group of professionals working with infants often at the highest risk of sleep-related death. And this training exists because of Dr. Berger's commitment to families and their babies, and her kind invitation to Cribs for Kids to collaborate on a statewide program for which she was awarded a grant. After 2 years, this Pennsylvania initiative became the launching pad for a nationwide module that we're going to be releasing next week. We are excited to share the collaborative nature that built this training, how it's reflected in the launch and the planned growth of Cribs for Kids' new professional training series. So super excited. I bet you are too, and that's why we have so many people logged in. But before we talk with Dr. Berger, we invited Reta Adler of the Baby Safety Alliance, formerly JPMA and Baby Safety Foundation, formerly JPMA Cares, to share some important agency news. Reta, welcome. Hi.
Hi, Devin. Thank you. Thank you, everyone, so much for joining us today. And we are so happy to be here with you.
Yeah, thanks for taking time to join us today. We know you have a lot happening with your team, and it's all good. We could all use some good news these days, that's for sure. So to get started, let's be sure everyone not watching knows about the partnership between Cribs for Kids, Safe Kids Worldwide, and your agency, kind of where we all intersect at Infant Safe Sleep, and how we came to work together.
Thanks, Devin. Clearly, I was a little too excited to join you today as I started talking right over to you.
I'm working on mastering these slides and reading at the same time, so hang on. It's a good thing there's no gum involved. So
Exactly. No gum for kids either. No, not at all. Thank you again so much for having us here today as we talk about our collaboration and partnership between the Baby Safety Foundation, Cribs for Kids, and Safe Kids Worldwide. The JPMA Cares Board of Directors, now the Baby Safety Foundation, made a commitment to safe sleep and reached out to Safe Kids Worldwide and Cribs for Kids to become partners. Each of our organizations really do share the same goals and visions in our commitment to creating better outcomes for infants and toddlers, and ensuring that those that need a safe place for their child to sleep should receive one, as well as our commitment to education and making sure that they know not only how to use the product safely, but delivers easy to understand and consistent advice and information. Baby Safety Foundation wanted to partner and work with each organization because of their own level of expertise. One of our first initiatives was to launch the Building Blocks Grant Programs with You, a nationwide initiative designed to break down barriers to safe sleep education and resources. The Baby Safety Foundation and our board of directors was so happy to fund the program, which provides essential safe sleep products, education, and community outreach support across the U.S. The Building Blocks Grant Program targeted not only Safe Kids Worldwide coalitions, but really other like-minded organizations that are committed to safe sleep, but face the challenges in expanding their own efforts.
Yeah, we absolutely loved that invitation. So happy to have the three of us together again on this shared mission. The more the merrier, right? And
Absolutely.
we had an incredible response to that Building Blocks Grant opportunity, right? I mean,
oh yeah, huge.
Yeah, we had originally planned to award 20 mini grants and thinking, we don't know, well, what if we don't even get that many applications? Then what do we do? But we had over 200 applications for the mini grant. So we went back to our shared budgets and went back to Judy Banham. We're like, what can we do? Can we expand this? And you guys went and said, yeah, we can expand ours too. So we were able to double the amount of grants awarded from 20 to 40. I mean, that's no small change when you're planning something like that. So we reviewed all those applications. And at the end of last month in June, we contacted all 40 awardees agencies, and there were so many great ones, but the 40 then were really rose to the top. and they'll be getting their 20 safe sleep survival kits with our cribette play yard, along with the toy kits and education to support that. And that's all going to be shipped out to them at the end of this month. Yeah. And then we know they're going to do great things because they told us about it in their application. So if people who were watching, joining us live or recording, want to find out what these 40 agencies are doing with their Building Blocks mini grants, be sure to follow Cribs for Kids and Baby Safety Foundation on social media. Sign up for the partner newsletters, because we'll be sharing as they share with us what they're doing with all those good works. That's 1,600 cribette pack and plays and a bunch of toy kits and more education going out later this month. So we're super proud to work with your agency on a program like this. But wait. The reason you're here is there's more, right? You and your team are managing a pretty big change across your agency. So tell us about that and why I keep saying Baby Safety Alliance and Baby Safety Foundation instead of JPMA and JPMA Cares. You've got a great new t-shirt on. We see your background. So tell us what's up.
Absolutely. Yeah. And again, back to the Building Blocks grants, we are so excited. Our board of directors was so excited and so proud and honored to be able to help fund these initiatives. And hopefully in the future, we can help to even fund even more organizations just like the ones that are awarded during this cycle. But for more than 60 years, JPMA, the Juvenile Products Manufacturers Association, has been the voice of quality and safety for baby and children's products. We work to advance the safety of products used to care for babies and young children. Now we're moving our mission of baby safety to the forefront by bringing it to our organization's name. While JPMA has been inclusive of members and partners beyond manufacturers, we also believe that the word alliance better describes our collaborative efforts across manufacturers, retailers, parents, partners, and more to advance baby safety. We are thrilled about our new chapter and invite all who are passionate about advancing baby safety to join us. At the Baby Safety Alliance, we advance baby safety with efforts across the strategic pillars: advocacy, product safety, education, and philanthropy. The Alliance's education initiatives includes providing free expert-approved baby safety guidance to parents and caregivers through our Baby Safety University. The Baby Safety Alliance helps expecting and new parents choose and use babies and children's products while keeping safety top of mind. Safety tips for sleeping, transporting, feeding, playing, bathing, diapering, monitoring, protecting, and even more can be found on babysafetyuniversity.org. The Baby Safety Alliance also focuses on philanthropy through the Baby Safety Foundation, our 501c3 charitable organization. Founded back in 2021 as JPMA Cares, the Baby Safety Foundation aims to create better outcomes for infants and toddlers by reducing preventable injuries and deaths and providing families in need with donations of time, talent, and product. Our name and brand have changed, but to put a focus on what truly matters to us the most, baby safety. We're evolving and growing while staying rooted in our mission to champion safer products for babies and peace of mind for parents.
Yeah, it's good stuff. I think now might be a good time for me to mention that all of Cribs for Kids infant products are JPMA, but now Baby Safety Alliance certified. So when you see our products, know that we are Baby Safety Alliance certified. So your leadership wanted to ensure that the face of the agency and the name all aligns with the work that you're doing. And your team then, you rattled off everything that, in terms of foundation work and working with parents and how broad your scope is. But you just made another great announcement about another development related to safety.
Oh yeah, we have been extremely busy in 2025 so far, and really in the last month or so in general. And another big announcement we have: last month, U.S. Representatives Debbie Wasserman Schultz, Earl L. Carter, Raja, I'm going to butcher this last name, so please excuse me, Krishnamurthy, and Don Bacon officially launched the Congressional Children's Safety Caucus. The bipartisan caucus will work to find and promote solutions to dramatically reduce preventable childhood deaths and injuries. The inspiration for this caucus came from the Baby Safety Caucus event that JPMA, Safe Kids Worldwide, and Amazon held at the Capitol in September of 2023, with the goal of empowering parents to make safe choices. JPMA, now the Baby Safety Alliance, and Safe Kids Worldwide decided to pursue a permanent caucus in Congress with the same vision and goal. After more than a year of government affairs work from the Baby Safety Alliance and Safe Kids Worldwide, the caucus has officially launched. The launch is so significant in the movement for the Baby Safety Alliance, Safe Kids Worldwide, and all stakeholders who are concerned with protecting our most vulnerable population. The Children's Safety Caucus will focus on issue areas like child passenger safety, water safety, and of course, safe sleep. An important goal for the caucus is to host meetings and forums through the congressional sessions to highlight the need for bipartisan support for children's safety issues. The caucus will update members of Congress and their staffs on relevant legislation, best practices to better inform constituents, and host events to promote child safety. Stay tuned for more information to come and some pretty exciting dates that we're hopefully going to be releasing in the coming months.
Yeah, it's good. It's clearly you're not twiddling your thumbs over there. So
not at all.
This caucus idea is great. Even more important with all the discussions that we hear going on regarding the CPSC. So a way to keep that baby and infant safety and child safety forward through the government, through the caucus is really great. So, and like us, your agency keeps creating resources when you identify gaps, like the gap where you see the caucus, you've found out what that was, created that caucus. And we do the same thing. We've, develop resources where we identify a gap, like our Safe or Not Safe photo module, our professional training series that we're doing today. And the Baby Safety Alliance has a new resource that's on deck for those that are caring for new babies. So I know it's a coming soon thing, but can you tell us a little bit about that?
Give you a little bit of a sneak peek today. So actually through our strategic planning sessions last year with our Baby Safety Foundation Board of Directors, we're also really excited to officially launch in just a few short months our Baby Instruction Manual. Still a working title, not 100% done yet. We know that parents and caregivers, especially those that are having their first child, joke that babies should come home with an instruction manual when they come home from the hospital. And now we're helping to really make that happen. But unlike a traditional instruction manual that we all know kind of gets stuck in the corner, sometimes never even opened, these will include easy bullet points in each chapter, talking about the top questions that they have in areas not only of safe sleep, but car seat safety, safe places for baby to play, feeding, baby proofing, product labels and warnings, and more. Our committee is collaborating with some of the leading experts in the spaces, including Dr. Michael Goodstein. We'll be launching the baby instruction manual in the beginning of September, just in time for Baby Safety Month.
Yeah, when you mentioned the manual to us and would we take a look at the safe sleep, and then you said Dr. Goodstein's name, we are happy to join anything that Dr. Goodstein, our board member, medical advisor, one of the architects of our hospital certification program, if he's on it, we're on board. And we really appreciate being invited to be part of that new project. And because we know there's more to come from our shared mission, from a possible second grant program and our October stories for Infant Safe Sleep Month to prevent suffocation in SIDS. We'll be collaborating on that. So if people want to be sure that they are staying up to date, tell us how they want it, how they can be sure to know everything that's going on at the Baby Safety Alliance and Baby Safety Foundation.
Absolutely. Check out our brand new websites, all new and redesigned, pretty colors and logos. babysafetyalliance.org and babysafetyfoundation.org. Our upcoming events calendar, educational webinars are all always free and open to anyone to join. Information on our own programs and upcoming initiatives that we have. Obviously, if anyone ever has any questions, they can always reach out how to get involved, receive our newsletters, whether that be from the Baby Safety Alliance or the foundation. And you can reach out to us at info@babysafetyalliance.org or info@babysafetyfoundation.org. I know Devin might hate me for saying this, but feel free to pass along my contact information directly. And I'm happy to always answer any questions that anyone has.
Yeah, no, I'm happy to pass on any information. And I just got your 3-Minute Thursdays email today. That's a great one to get, and listing all the webinars that are coming up. So yeah, we'll throw your name out there. Don't worry.
Absolutely.
So, Rita, thanks so much for making time. We appreciate it. We know it was short notice, but you had so much going on. We wanted to be able to share it. So a quick reminder for those of us who are joining live, any questions you might have for Rita, put that in the Q&A. We'll get them to her with answers back to all of you. So thanks, Rita. We're going to get ready.
Thank you, Devin. Thank you so much for having me today.
Bet. Thanks for coming. See ya. Okay, we're going to get ready now. Dr. Berger is joining us today as Cribs for Kids launches its professional training series with our first module, that is designed for child welfare professionals, those people working with the highest risk infants. I want to take a minute to talk about our new professional training series. You can see the coming landing page here. It is designed to build on our Safe Sleep Ambassador education, but more in-depth and targeted advanced modules for those working across different areas supporting families and their babies. So it's a lot denser when you go in there. We're going to release these advanced modules with content specifically designed for professionals. So after the child welfare module that we're talking about today, look for the home visitor module next. And then the child care module, the child care professional module will be coming at the start of the fall, and with more modules coming for first responders, nurses, doulas. And then you tell us, who were we missing? I think that people who are watching know that we rely on that feedback so that we can make sure everybody has what they want. To develop this new training series, we welcomed Spencer Poston to the Cribs for Kids team at the start of this year. She is our new program and outreach manager. She joined us having worked with Dr. Berger as the program coordinator for the Pennsylvania Child Welfare Project. So she brought her experience working on that project to drive our professional training series, where she's developing content, developing evaluation strategies, the accompanying tools that go with each of those modules. And this development includes that expert guidance from people working in those targeted fields, like Dr. Berger, along with Cribs for Kids stellar program advisory board members. So it's the collaboration like this that we do to ensure that our modules are appropriate and meaningful for those working in the fields that they're designed to support. You'll learn more about Spencer in our October webinar when we talk about the next modules being released. But for now, we're going to talk with our Summer Safe Sleep champion to learn more about the impetus of the professional series and the unique approach to its content. One more reminder about the Q&A for today, because I bet you're going to have some things to ask Dr. Berger. Okay. Welcome to our Safe Sleep champion, Dr. Berger, coming to us. We thought you'd be here, but now you're in Harrisburg. So here we go, right? Going to make it work. Dr. Berger is a nationally recognized expert on child abuse and neglect who has dedicated her clinical and research career serving children and families. Last year, Dr. Berger earned her appointment as the medical director for the Pennsylvania Office of Children, Youth, and Families within the state's Department of Human Services. Prior to this appointment, she had spent the last 25 years as a child abuse pediatrician at UPMC Children's Hospital of Pittsburgh. And she also served as the medical director for the Western PA Child Abuse Initiative, a program designed to assist general emergency departments to identify and evaluate suspected child maltreatment. And she also led the Allegheny County Infant Child Death Review Committee for 5 years. On a national level, Dr. Berger served as the research lead for the Federal Commission to Eliminate Child Abuse and Neglect Fatalities during the Obama administration. Look at that. Without even mentioning her unbelievable education at Harvard and Columbia, you can see why Cribs for Kids was positively honored to have been invited to collaborate with her to develop and implement safe sleep training for child welfare professionals across our state of Pennsylvania and now across the country. And so for the next 40 minutes or so, we're going to share with you the design of this program, what makes it different from other safe sleep trainings, and how this approach will be reflected in our work on this professional series moving forward. Rachel, finally, hi, thank you. I am so happy to share with everyone this work. I keep saying, Rachel, you should win an award for this. So I want to share this with everybody. We're going to dive in and tell us about where this program started. I think that a background, we have such a diverse audience of safe sleep advocates on this call that I think getting the background that led to this development of this will give everybody some solid ideas as they look at the own work that they do.
Awesome. Thank you, Devin, for that introduction. And I'm thrilled to see how many people registered today. That's just fantastic. So I'm so happy to be here. So let me talk a little bit about this program. I said this actually started almost 10 years ago when the Hillman Foundation, which is a nonprofit based in Pittsburgh, where I was from, came to talk to me about an effort they were spearheading to decrease infant death in Allegheny County, Pennsylvania. This is actually the first and the only time in my career as a clinical researcher when a funder came to me with money instead of me going out and searching for money. So I talked with the Hillman Foundation about how safe sleep was the leading cause of death once our babies left the newborn nursery. And I thought that we needed to focus on safe sleep. And I think that they thought I was going to tell them that we needed to look at the issue of child abuse, since I was a child abuse pediatrician and all of my research really up to that point had focused on child abuse. But although my research had been about decreasing morbidity and mortality from child abuse, myself and I think many pediatricians have an interest in safe sleep, and it really comes from our clinical experience. As being the physician in the emergency department when a baby comes in who has died from unsafe sleep, talking with that family of parents who have just lost their baby, it's almost one of those indescribable moments in a physician's life, and knowing that you don't want to ever have to do that again. Just the idea that this family's life is now changed forever is something, just as a physician, I never forgot. And so I think that's something that drove this from the very start.
Yeah, we hear that from doctors, nurses, first responders, the impact that these preventable infant deaths have on the work that they do and how they move forward, maybe change their practice. And you took, with that experience, surprisingly, a methodical approach.
Well, I think that for clinical researches, which is what I think of myself as, there's always a human story, and it's often, unfortunately, a tragic human story, and that drives our research questions. So our role is to kind of morph the passion from that clinical experience into the methodologic scientific approach. So that's what I think we tried to do here. So with our money from the Hillman Foundation, we started a multi-pronged approach to addressing safe sleep. And I should say that around the same time, although this was about unsafe sleep deaths, I became very interested in unsafe sleep injuries, infants who fall from beds and couches when they are co-sleeping. And I really began to realize how many of the children that we were seeing in our emergency room and also in our intensive care unit, because that's where an infant will go if they get a skull fracture, for example, with a bleed in their brain from a fall. I realized that I was actually probably evaluating and seeing many infants with unsafe sleep injuries. But as a physician, we weren't actually asking all the time, like, was the baby awake or asleep when they fell from the bed? And so there really was almost no literature on the issue of bed falls due to unsafe sleep or just falls from any surface while sleeping. And so we started collecting data on that at the same time that we were looking at unsafe sleep deaths. And one of our questions from the start was, are these the same infants? Are these falls opportunities to do education and really the predecessor potentially of unsafe sleep deaths? So that was a little bit of a digression, but what we started to do with the Hillman Foundation, we first started with data. So we looked at all of our sudden infant deaths in Allegheny County from 2013 to 17, and we looked at all of the deaths reviewed by our child death review team and tried to pull the same data out for every infant, entered it into a database, and started looking at patterns. For example, one of the patterns, we saw that there were hot spots where our deaths were clustering. A very small number of zip codes in our county were accounting for a large proportion of our deaths. And this is where we first started identifying that substance exposure in utero was clearly a risk factor. We then did an anonymous survey of pregnant mothers. We had QR codes hanging in all of our high-risk clinics at our birth hospital. And we started trying to better understand what the local culture was related to infant sleep. We then subsequently started trying to look at intervention. So we integrated some validated educational materials that Dr. Rachel Moon and her colleagues had developed, and we put them into a novel pregnancy app. It was called My Healthy Pregnancy app. And we evaluated how and whether pregnant women would watch the videos, which videos they watched, when they watched them, how often they watched them, and what type of women were most likely to interact with the app. And our goal, our hope, was that women at highest risk of unsafe sleep deaths would interact with the app. And indeed, that's what we saw. And we published this paper earlier this year about this app. And then kind of finally, we brought together partners to do something that was a little bit different than traditional child death review. We did prospective, multidisciplinary, rapid root cause analysis. When I say rapid, within 6 weeks of the death, we were doing these root cause analyses. And we did them both for sudden unexplained infant deaths and for unsafe sleep injuries. And we collected the same data every time. And this started in about mid-2017. And actually, this morphed into the Allegheny County Infant Child Death Review Team in about 2021. And so I should say, while we were doing all of this, we got some funding from Cribs for Kids to do a qualitative study interviewing parents who were practicing unsafe sleep, including some who had had injuries, their children had injuries due to unsafe sleep. We did not talk to parents whose children had died. So these were children parents who were practicing unsafe sleep or whose children had had injuries. And then basically we pulled together all of the data from all of this work. And it became clear that infants with prenatal substance exposure were at very high risk, both for unsafe sleep injuries and for death, and that Child Protective Services was involved with a remarkable number of these families, either between the time of the infant's birth and the event, either the death or the injury, or in the very recent past when there was another child in the home that Child Protective Services was involved with. And so this all led to this funding in 2022 from Pennsylvania's Office of Children, Youth, and Families, where I currently work, but I was not working in 2022, to develop this comprehensive program focused on child welfare caseworkers. And we did this in collaboration with Cribs for Kids.
Yeah, when you came to Cribs for Kids with this child welfare training project, I mean, you came to us and we were like, yeah, we're a hard and fast yes on this, let's go. But we hadn't caught up to what your vision was on this, and it just kept growing and getting more and more exciting. So as you were applying for the grant funding with all of this data that was supporting why you were applying for this grant funding and why you were going to develop this project, what was your plan for the scope of this ambitious project based on everything that you had learned?
I think that from the beginning, my overall goal was to empower child welfare caseworkers so that they could empower families that they were serving. And so what I had seen was that we often tell families they should do something or they shouldn't do something. But we had often not been sharing with caseworkers or families the reasoning behind that. And so, of course, as a scientist, I thought, well, let's focus on the science behind the recommendations, helping caseworkers and then ultimately families, the why, that I thought that families would then use that knowledge to inform what they did. So really, the understanding the why behind the recommendations. And I should say that one of the challenges we have in child welfare is that child welfare caseworkers are often very young. They're often straight out of college. They often have taken the civil service exam and then they choose child welfare. So they could have been done anything else in civil service, but they choose child welfare. Many of them don't have children on their own, and they may know very little about safe sleep. And what they do know is from social media, which we know isn't the best place to get information. But they are the ones who are in the homes of the highest risk families. And honestly, they have an opportunity that almost none of us have. Pediatricians, for example, we don't go see how a family, where they live or how the parent interacts with the child outside of the office setting. But the child welfare caseworker has that opportunity, and we wanted to take advantage of that with this program. So we decided to build on the Safe Sleep Ambassador program, make it relevant to this sometimes unique, but also overwhelmingly high-risk group that Child Protective Services workers are seeing. And then we wanted to provide a guide for how, very practically, how to have conversations, which can be very difficult with families, about safe sleep. And then we wanted to make this part of a larger comprehensive program. So to give child welfare caseworkers access to safe sleep sacks, to cribs, to educational products, to web-based tools, so that they had everything they needed to work with families when they were in the home.
Yeah, it's really great. This is definitely the most collaborative project I've ever worked on in the field of safe sleeps. There's so many meaningful elements to it because of this. And so, but before we get to some of that unique content, you also started this project with the vision of developing it for adult learners to keep them engaged and to get their feedback and ensure that collaboration.
Yeah, so from the very start, we wanted to make sure that the training incorporated tenets of adult learning. For example, we made it interactive. We used a program called Slido, which there's a lot of them like that, but essentially allows us to embed questions in the webinar for the audience so they are continually participating. And because the Safe Sleep Ambassador training was a prerequisite for this webinar, we were able to spend a lot more time on the practical skills about how to talk with families at a home visit. And the other thing I should mention is how we decided to deliver the training. And I think that in-person training has a lot of benefit. But I have to say, realistically, the state of Pennsylvania, it's about 5 hours to get from the east to the west and another few hours to get from the north to the south. And we have thousands of caseworkers. And so we knew that we could not present this only as a live training. So we landed on a combination of some live trainings, some live webinars, and then we worked with the Child Welfare Resource Training Center, we call it CWRC, which is the Pennsylvania Child Protective Services, basically our business partner for delivering education to caseworkers. And they recorded one of the live webinars and they posted it onto their site and allowed the caseworkers to go take it, get their training credits whenever they wanted to do that. And just in the first year, over 300 caseworkers watched the webinar through the CWRC, as you can see. So that was actually I think this multimodal way of presenting allowed us to touch many more caseworkers than we could have possibly done in person.
Yeah, what a great thing that they did. And what a nod to really how valuable this module is, that they said, can we put this up and make it available, right? I mean, that's really a great nod. So, and that comes from the module itself. So let's talk for a little bit so people understand when they go look at the module, when they're able to see it, they'll recognize the unique organization of it, right? We start when we do this by introducing that we are holding the training, why we're holding the training, that the babies that they work with are far more likely to die of unsafe sleep than abuse. I think it gives them a good reason to engage from the very beginning. And I think a lot of them are surprised to hear that. And then we do a quick review of the core elements of the Safe Sleep Ambassador, right? As we've talked about, this is what this training builds on. And then we present how the caseworker can use that information to evaluate and guide their visit. Specifically, we spend a lot of time on the fixed and variable risks of SUID and how they can be presented to families and discussed during their visits. And I think that really helps because it helps them to understand why they're talking about this.
Yeah, again, I think this really gets at the why. So by understanding the risks, it helps the caseworkers see where their work can impact. So we present, as you can see by this, the variable risks, fixed risks, and then this idea of the triple model. And that the idea that some of these fixed risks, prematurity, prenatal substance exposure, low birth weight, these are done. They can't do anything about them, but they increase the infant's risk for death. And so caseworkers need to understand that going in, just like they would go in knowing that there's intimate partner violence in the house or there's substance use in the house. And that will frame their thoughts about how they interact with the family for other prevention type efforts. So we talk about the why for these, and then we talk about the variable risk factors because that's where they have the impact. And we primarily focus on substance exposure and unsafe sleep practices. But I think by showing them this Venn diagram, we've got the variable risk, the fixed risk, and then this critical period of development, namely young infants. We're able to focus on the interplay and how they can't do something about all of these things, but they can prevent all three of these colliding into the center, the death. And so I think this makes it understandable. And it also, again, gets back to this empowering through knowledge.
Yeah. And we talk in the module, we talk about, preparing for your visit. If you know that your family has these fixed risk and these variable risks, it's so important that you have these conversations. So giving them ways to talk about safe sleep, understanding this is why they're doing it and how to prevent suffocation and reduce SIDS risk.
Yes, and actually it's an interesting point. We made the very conscious decision to use the word suffocation. It's a word which caseworkers understand, family understands, and it also highlights that these deaths are preventable. And then we really talk about everything we've been talking about, how everything that we talk about in the module can be applied to the home visit. So we highlight the importance of the caseworkers preparing for the home visit, just like they would prepare for a home visit for any reason. Now we ask them to prepare for it in the realm of safe sleep, and they can tailor their conversations to the risk that they know the infant has. If it's a full-term infant, they don't need to talk about why prematurity is a risk factor. So we ask them to prepare for the visit, looking at this idea of these different risks. It's something they always do. They prepare, but they're doing it through this lens of safe sleep. And I think the parents are going to respond much better because the education is tailored to their child versus this general discussion of children in general. And so I think this very personalized message to families is something that caseworkers are then able to do.
Yeah, and I think, as you're saying, it gives the family a comfort level, and it would give me as a caseworker a comfort level, knowing this is why I'm talking about this. Here's what I need to focus on. And so that it isn't like I'm just going through a list and checking things off, but really having that dialogue. And in part of that training, we include information on actions that families can take to reduce the risk of SIDS and suffocation and how important those are when it comes to the highest risk infants, right? Like we are focusing on, when you look at that module, it's focusing on practical applications of observation, open dialogue, offering safe sleep support and resources to support their commitment to it, even some social media pages and accounts that they can go to find a place to support safe sleep. And not always we talk about, we got rid of our, finger wagging, don't do this, and replaced it with the do this, but this also adds to it, not only with the why, but also some of the how in it.
Exactly. And this goes back to the idea of teaching the why. So, for example, we talk about infant anatomy. We talk about the concept of arousability. I've had so many parents in my careers just tell me so proudly their babies sleep so much deeper on their stomachs, and that's why they like to sleep them on their stomach. And I always tell them, well, yes, you're absolutely right. But that's actually a bad thing, right? You want an arousable infant. And when you talk that way and tell them that way, this light goes off because they understand now why prone sleeping is dangerous. Don't just say, don't put your baby on your stomach, but they suddenly understand. And plus you say, yes, you're completely right. The baby is sleeping deeper. However, there's a reason we don't want that. We also talk a lot, multiple times actually in the module, about the risks when infants are sick. And when babies are sick, parents are most sleep deprived. They sometimes make the least good decisions. And that's when they often bring a baby into bed with them because they want to comfort them and they also want some sleep. But yet this is one of the most dangerous times to bring a baby into bed. And when you explain this to parents, again, they understand the why. And our hope is that that empowers them to make the safer choices.
Your qualitative research showed that, right? There were some people in the research who was saying, well, we were practicing safe sleep and then he got an ear infection and then we started to bring him into bed. And then, so I think, again, focusing on that, here's why you might be making a decision that is unsafe, and helping them to understand why that is, as you're saying. So not the right thing to do at the, or doing the wrong thing at the worst possible time. But also in this module, we spend a lot of time, not a lot of time, but we include information on infant products and sleep environments, right? Products that aren't safe for sleep, how caseworkers can identify those. As you mentioned, a lot of them are straight out of college and don't have any familiarity with this. And so it's, again, they're in a unique position. As you said, pediatricians aren't in the home, but caseworkers are in the home. So if they're able to discuss what they might see or not see when it comes to sleep and how to discuss that with families. Our safe or not safe photo module does that really well. Is this safe or not safe, and telling them what's not, but we also built it into there's a good section in this module on that topic. And so we thought we covered everything, right? And then we had it all in the module. We had feedback from some of the folks, and then we went out to do our first presentation, right? I can't decide if it felt like last week or 10 years ago, because we've covered a lot of ground.
So yeah, we put together this module taking into account everything we talked about, and then we tried it out. So our first presentation was to the Allegheny County Child Protective Services team, and this was virtual live because they have 5 different offices, so live wasn't really a possibility. And there were so many questions in the Q&A afterwards, which was great, and we integrated some of those questions into our presentation. And I always say, if one person's asking, many, many more are thinking. So for example, I remember in that first one, there were questions about co-bedding with twins. And it was something that had changed like 20 years before in my residency, that we no longer co-bedded twins, but yet it was clear that people still thought that twins should be in the same bed, right? So we clearly had to put something in about that. There was a lot of questions about reflux. That was probably the most common one. So now there is now a discussion of reflux. And there were some interesting questions about sleeping in car seats while driving the car, because we kept telling people, don't put them in a car seat. They shouldn't be sleeping. And they're like, yeah, but when you're driving, they're in a car seat. So a lot of really good questions that we then integrated into the webinar itself.
Yeah. And good questions too, right? Why can't twins be in the same sleep space? They were in the belly together. As you said, why can't they be in the car seat? Because they sleep in the car seat because they're in the car doing that. And so when we get the questions, we incorporate it. We get the questions, we expand it. So, and that was the process we followed, whether in person or virtually. Do the training, get the team members' feedback, note new questions, update the information presented, find some resources to support it. And we kept doing that every step along the way. And we developed some tools that you can see here that will be part of the professional services landing page as well.
So right, I'm seeing, so basically with each presentation, we learned something new, and it led us to create this frequently asked questions, which is the one in the center, that just kept coming up over and over. And that we made this so not just for caseworkers, but so they could give this to families, because if this is what the caseworkers are asking, this is what the families want to know as well. We made a safe sleep assessment tool for the home visit. Again, this can be shared with families, but it also helps the caseworkers think through and make sure they're looking at everything in that safe sleep environment. And then we developed some videos, which we're going to talk about. And then all of this led us to creating this landing page for our child protective service workers in Pennsylvania, because now we had all of this stuff that was in all different places, right? So on the landing page, for example, they can link to that Child Welfare Resource Training Center webinar. They can link directly through this. They can get to their frequently asked questions. They can get to the safe or not safe. Everything is in one place, so the caseworkers can access it very easily. And it was interesting. I think one of the most surprising questions we kept getting over and over again was related to, what if the family can't follow the safe sleep recommendations due to their unique circumstances? And at the beginning, I was like, well, what do you mean? Like, I mean, we talk about, if there's no crib, you can use a laundry basket, or you can use, a drawer from a dresser. Those are the kind of things that we had talked about. But then we kept over and over getting questions like, what if the parents are so scared about gun violence that they don't want their infants anywhere where they can't literally touch and smell them, because they're so worried that there's going to be a bullet going through the window? What if they have a rat infestation? And if they put the baby in the crib, the rats are going to bite the baby. So they need to be able to shoo away a rat as soon as it shows up. And then a lot of questions about unhoused families. And so these situations really made us step back and think about something, I have to say, we honestly had not really considered for this very high-risk population.
Yeah. And so for this high-risk population, for the first time, we included suffocation reduction strategies in training. When you said there is no safe sleep space, there is no safe sleep option, how can we provide child protective service workers with knowledge on how to reduce suffocation risk when there isn't another option? And look, we know this is controversial. As an agency, we had to be so thoughtful about this, but it is necessary in these situations. So we were able to have meaningful conversation with the professionals in our live presentations. And I think that helped us to develop the suffocation reduction risk information that's in the online module. And Spencer did a fabulous job taking those conversations from those Pennsylvania trainings and crafting them for the national training, and then working with our program advisory board, especially Shana Rayfield, so fabulous, to ensure that the information that we're presenting like this in the national module is responsibly presented. So yeah, it's a big change for us, but it's an important recognition that we have to make. And so how do we, again, provide tools, provide information, empower people? So let's talk about those Pennsylvania trainings, right? Just the three of us, you, Spencer, and me, for the past 18 months or something, we have covered a lot of ground.
We definitely have. I said, as this is a map of all of our counties in Pennsylvania, and we have, as of the end of April, over 944 caseworkers from 60 of our 67 counties have either attended a live webinar, an in-person lecture, or a pre-recorded webinar. So the different colors, stars, I don't remember which is blue, which is pink, but those are whether there are people that did online versus and also in person. So you can see in some counties, people only did online, and some people, and I suspect the pink is online because those are our very rural counties. So we would be less likely to go there. So I said, we really have covered a lot of our counties, and we're continuing. I use the opportunity when we do have unsafe sleep deaths that we are discussing or that I know about, I then reach out to that county and see if they'd like a training. And then we go in and do those trainings. So this has really allowed for pretty good penetrance in our state. And the feedback from the participants has really been outstanding. I said more than 98% of them agreed that the webinar was helpful. They were more confident in their skills and they would use what they learned. And this can be a pretty tough audience because they have a lot of training they need to do. They sometimes grumble about it. So I really am very proud that they found this very, very helpful. And they continue to go online to take the training, I said, from their CWRC, the Child Welfare Resource Center training.
Yeah, I can't lie. I was a little nervous the first time going in front and doing this in person, knowing that they are a tough audience. They have so many things that they're managing. And what you see up here, we're showing some of the CPS workers' comments that we received immediately after the presentation. That's another feature in the training that allowed for that in the moment feedback. While they were there, they could just go in and tell us what they thought. So that again, really helpful and so positive, which gave us the reason to keep going, right? You could get that good positive work. And we still have the last deliverables for this state project, even though we're doing the national module release next week. We have some things that we're still doing for the state.
Yes, so the last thing is some animated video series, and then that are very specific to issues we saw in child welfare. So we're developing 4 short animated videos that the caseworkers can watch with the families, but these are focused on risk factors for unsafe sleep death, but specifically substance exposure. And that's not something that we had seen that was available otherwise. And so some of these are really about issues that the caseworkers, that child welfare caseworkers may be faced with, which probably haven't come up in other settings. So this is we're filling this gap in this targeted safe sleep area. And then we're going to put those into the safe sleep video library. One of the other ones which we're including, for example, which we're not making is, for example, how to put together a pack and play. That video exists, but that's something that caseworkers may use very frequently in the home. So we'll put that on their landing page so that they can easily access that with a family.
Yeah, and this has just been such an incredible, building blocks to follow as we do these professional series for these different kinds of professionals working. So there's so much new content, new resources, new tools. It has truly been an amazing project. I think it's important and meaningful content we hear for those working with the highest risk babies. So thank you. Thank you so much for inviting us to do this. And I hope we have such a wide range of people on these calls. As I mentioned on this webinar, we had 532, I think, by the time Andrea hit the noon go live button registered. And I think it's important that everybody here listen to all the different groups that you heard involved in this. So even when you just said, now, Rachel, sorry, I just thought, I'm listening to you talk and I'm like, well, wait, we should mention that. When you just said, when we have a death in a county, so if somebody here is on their FEMA or their CDR or a medical examiner, when you have a death in your county, know that you can go to that county CPS worker in the division and send them to this professional training series. Anybody can do that now. So I think that, there's a lot of good resources and everybody here understands how they can reach these highest risk families, I think, through this module. So thanks for that. And mentioning that, I think that, want to give people some sense of how they can use this. So, all right, one last thing. And people who have watched this before know that it's my favorite thing to ask because all of you brilliant people all have different brilliant ideas. We ask our Safe Sleep Champion guests their magic wand question, right? So imagine you have a magic wand, Rachel, and when you make a wish, when it comes to reducing infant mortality and sleep-related deaths, you would wish for what?
Well, I knew you were going to ask this because you always ask. So I had a little time to think about it. So my wish is that we can fast forward about 20 years to a time when our safe sleep culture is similar to the culture of infant car seats. We would never, ever put an infant into a car without a car seat. And with my magic wand, I would make it so that nobody would consider having a baby sleep anywhere other than on their back in their own safe place. But the other thing that I would want my magic wand to do is to get rid of all the misinformation, which is all around us on the internet and social media. So those were the two. I want my magic wand to do 2 things at the same time.
That you would have a special magic wand. I think that's right. Yeah, and because people who, when we talk about safe sleep, we say, why aren't people, their hair should stand on end when they see a baby sleeping with an adult, when they see a baby sleeping in these cribs full of things. But they don't, just like it would, if you saw a baby sitting on mom's lap in the front seat of a car. I hope we get there soon with that, because it is just kind of, and I don't think there's a how to ride in a car with your baby on its lap social media page that I could go to either. So I think you are hitting both of those things, that if we can get the safety to catch up, and if we can get this online misinformation to catch up, would be in a great place. We would be in a great place celebrating lots of first birthdays. So it has been truly such a privilege to work with you on this project. It is informing all of our other professional modules. And we were lucky enough to be introduced to our new team member, Spencer, through this as well. So thank you for that. Your commitment, your dedication, all the babies, children's, and families that you work for, they're all better for it, me included. So appreciative of your time and expertise, squeezing us into a conference where you are at the state capitol today. So really appreciate that. Thank you so, so much.
Thank you so much for having me, Devin, and for this whole project.
Yeah, love it so much. And so everyone, one last Q&A reminder as we get ready to close our webinar, right? If you've got something, a question, an idea, anything for Dr. Berger, please put that into the Q&A. We'll get that off to her. We'll address all of those. So if you've been here before, just like the magic wand question, or just like the video to set the stage for the beginning of our webinar, you know we close our webinar with 3 things: a call to action, registration for our next webinar, and playing Just Baby, our safe sleep lullaby. So let me show you what I'm going to show you here. Okay, so the action item for this webinar, I bet you can guess, is to complete the child welfare training. Your visit could save a life. It's the first module in Cribs for Kids professional training series. It's going to be available 1 week from today on July 17th. So go ahead and circle that date in your calendar. And because you're watching this webinar, we know you are an engaged infant safe sleep advocate working to prevent suffocation and reduce SIDS. So no matter what field you work in, completing the child welfare professional training is going to support your goals and the work that you do. I promise you that. So mark your calendar, carve out about 40 minutes. It's dense. There is a lot of information in it because it's a professional training series. And do that anytime beginning July 17th to take this training. And if you haven't done so already, or you feel like you might need a brush up, this gives you time to complete the Safe Sleep Ambassador module. Remember, this is a prerequisite for the professional trainings. So go ahead, do that, and then go do that professional training module. So you'll go to cribsforkids.org, click on education, and there you'll find a link to the professional series landing page. And that's where you'll access the training module, along with our first round of resources for this new training series that's going to be designed to support the work of specific professionals with distinct opportunities to deliver safe sleep support and education to the families they work with. Because that's what's guiding the development of the Cribs for Kids professional training series, giving those home visitors, childcare workers, doulas, and first responders the tools that they need to support their role in preventing sleep-related deaths. Because certainly as a childcare professional, if I'm in the home or I'm in a childcare center, I'm talking differently about safe sleep than if I'm in a first responder in a home. I have different opportunities and should have different tools. And that's what we'll be giving you with those, with the help of our program advisory boards and experts working in those fields. So look for that child welfare module on July 17th. And then next up will be the home visitor module. We hope that that will be up in about 6 weeks. And then the child care professional module will be coming this fall. It's a short action item. I made it sound really long. Just go take the module. How's that? So next is our fall webinar registration. Our Fall Safe Sleep Champions webinar is on Thursday, October 2nd at noon Eastern. It is also Infant Safe Sleep Month. So we're going to use that fall quarterly Safe Sleep Champions webinar to kick off Infant Safe Sleep Month with our Safe Sleep Stories social media campaign. Be following us, and we hope that you'll send us your safe sleep stories. We'll be debuting another professional training module and probably talk to some more Safe Sleep Champion guests. Registration for this will open later today for that October 2nd webinar. So you can get that all in your calendar along with the July 17th module release. So really that's 2 action items, I guess, 2 calendar action items. And as always, we end our hour with Just Baby, a safe sleep lullaby. Like our other safe sleep resources, our ambassador, our Safe or Not Safe photo module, our new professional training module, our video library series, our hospital certification program, our NPSI program, all of these resources are available at no cost. So our lullaby, the song, the video, the music bed, English and Spanish versions, download that WAV file to use on hold music or play across your unit or in your office, open a training session with it. It's a really fun little piece to have. You can find all of that, including the lullaby, on our partner resources portal that links via our partner menu item on our website. Thank you again to Reta Adler of Baby Safety Alliance and Baby Safety Foundation, one of our very valued collaborators, and to the fabulous Dr. Rachel Berger, Medical Director of the Pennsylvania Office of Children, Youth, and Families. Without brilliant colleagues like this, we couldn't do the work that we do. And as always, thank you to those of you watching. The time and commitment that you share with us for an hour like this today is how one day every baby will wake from every sleep. Remember, if you've got a question, put that in the Q&A for our guests and staff, and we'll see you in October.